Thank you, Presiding Officer. As a member of the Health, Social Care and Sport Committee who has been present during the entirety of the committee scrutiny of the bill and during the Stage 1 report, I do welcome that this bill is at Stage 1 today. And I'd like to thank everyone involved in providing evidence, and for the clerks also, and of course anyone who provides care for our people across Scotland. What we have to remember with this bill is that it is about a change which may be described as monumental, as the creation of the National Health Service was a framework legislation as well as this legislation. So we need to remember that. And I want to be clear that the evidence that we've taken at committee has clearly demonstrated that the current social care landscape is cluttered, is complex, and that it isn't working for those requiring care, who are some of the most vulnerable people in our society. This Parliament has a duty, therefore, to those individuals to get this bill right and to have a social care system which meets the demand of our society, but which is underpinned by the principles of human rights, respect and person-centred choices. Presiding Officer, there is a need for standardisation of the social care system, employment practices, education for social care workers and of social care standards across all of Scotland. And from evidence, it is clear that yes, sure, I will.
Gillian Mackay.
I thank Emma Harper for taking intervention. Would she agree that as part of that we also have to look at self-directed support and how that's delivered across the country as well, and make sure that when we're looking at the National Care Service as a whole, it's not just directly delivered services but self-directed support too?
Emma Harper.
Absolutely. I thank Gillian Mackay for that intervention. I am coming on to self-directed support, but I think that is part of all of this complexity that needs to be reformed so that we can make changes and help support our most vulnerable people that need care. So thank you for that. From the evidence, it is clear that one of the best ways to do the changes is through reform and integration of joint boards, as the Minister has set out to the committee. And at committee, we have heard repeatedly from people with lived experience that the current adult social care system must change in order to drive up standards to a consistent level across our country. One of the ways it is intended that these aims be met is through the creation of a National Care Service Board. And the NCS Board will ensure that there exists consistent, fair, human rights-based social care support and community health services in place. The NCS Board will be responsible for reviewing and overseeing the performance of local strategic plans. And to support this, the Scottish Government is proposing to transfer ministerial powers of intervention to the Board. This will allow the Board to invoke these powers as a last resort, and it gives the levers needed to drive and support performance and act if required. As a former clinical educator and a nurse, I am really interested in how this board will help to standardise social care and social working care, how we approach it across the whole of Scotland. Just this week, my office spoke with a local care provider across Dumfries and Galloway about the NCS board and the standardisation. They welcomed this approach. In Stewardship Care, they were one of the folk that gave us evidence when we visited Dumfries. My office called them the other day. They're one of the largest providers of social care across Dumfries and Galloway, and they stated that although they carry out mandatory moving and handling training for their staff, much of the training they do on top of this is not mandatory. And Stewardship Care also trains staff on assessment of nutritional status, and their staff are given education on how to spot the signs and symptoms of malnutrition of those within their care. However, it was evident, as from the meeting with Food Train last week, that this kind of education is not a universal practice. And many care providers don't have this education or training, despite the importance of nutrition and the commitments in the Good Food Nation Act passed by this Parliament. This is just one example of an area of education which would benefit from standardisation across the whole of Scotland. And I would ask whether the Minister agrees with me and that we should consider nutritional monitoring as being part of the national standards as the bill progresses, not necessarily in primary legislation, but look at how we consider that as we look forward to moving standards forward. Presiding Officer, I also want to touch on the commitment to establishing a National Social Work Agency, which COSLA has agreed with. And for those working in and leading the social work profession, the establishment of a national social work agency is a vital piece in the jigsaw of reform. And as has been noted by Social Work Scotland, the current national arrangements for social work are messy and inefficient, with the Scottish Government, employers, SSSC, Social Work Scotland, improvement bodies and many others. They're all separately leading on aspects of social work's development. But if we are to affect the changes in social work systems and practice outlined by the Independent Review of Social Care and the Promise, and which the profession itself has called for, we need to create an enabling context. The National Social Work Agency has a real potential to address these challenges. Currently in Dumfries and Galloway, social workers are paid the lowest wages than all other Scottish social work departments. That's why some of our social workers, they're leaving to go and work south of the border and to other parts of southern Scotland. So this is something that could be addressed as we take a national agency forward. Another example is that self-directed support, which Gillian Mackay intervened on me about. That's administered with a quite variable approaches by different local authorities, with some performing really well and others performing not so well. So I would ask the Minister to confirm that it is the Scottish Government's intention for the Social Work Agency to deal with these kind of discrepancies, to support the social work profession and get it right for those engaging with social work. So it's clear that this bill is needed to improve social work care and social work landscape in Scotland. So in closing, Presiding Officer, I will be supporting this bill at stage 1 and urge members to do so. Thank you.